Namaste, Dr. Avishta here. So today I'm going to be talking about lower backache. Now, there can be various causes for lower back pain. First, let's talk about the structures there. So we have bones which make up like your spinal cord. Then in between the bones, we have a little gel-like, soft cushion-like structure which is known as an intervertebral disc, which is also sometimes known as a shock absorber. Next to the bones, we usually have muscles which are known as paraspinal muscles, and between the bone and the disc we have some nerves coming out on the side. So these are the structures around the lower back. Now let's talk about arthritic type of back pain. Now arthritis can also cause lower back pain. Now the most common cause of arthritis that can cause lower back pain is known as ankylosing spondylosis. Obviously when I say arthritis, all of us are already thinking joint pains, pains in your knee joints or pain in your fingers. See that all of that are various types of arthritis. So the one that commonly affects the spine is known as ankylosing spondylosis. It causes a lot of inflammation around your spine. It can cause muscle stiffness and pain. The pain can be waxing and waning in characteristics, which is to some days the pain might be less, some days the pain can be more. And this is usually diagnosed by an orthopedician or a rheumatologist. Now the next cause of lower backache can be a disc-related issue. So as I said, there are bones in your spine, there's a little bit of discs which are there, which are jelly-like substances which are known as intervertebral discs. Sometimes, again, due to an unnatural posture or due to bending down or lifting a heavy object, these discs can tend to pop out a little bit or come out a little bit, and because of that you get a lot of pain. So suppose you bend down and you lift a heavy object and you suddenly feel like a popping sensation in your lower back, followed by excruciating pain and then inability to move. You tend to immediately lie down because the pain is so bad. Most likely the cause could be a disc-related issue. And over a period of time, sometimes if the disc-related issue is really bad, it can compress one of the nerves on the side. So what you feel is a lower back pain, and with the pain that tends to radiate on one side of your spine, along the back of your buttocks, along the back of your thigh. And this is also known as sciatica type of pain. And this is usually one-sided. It can be associated with change in sensations like tingling, numbness, or even over a prolonged period of time, loss of sensation. So this is very characteristic of a disc-related issue. Now the next cause of a lower backache could be kidney-related issues. Now when I say kidney, obviously you're already thinking the pain must be somewhere here. Yes, that's where your kidneys are. But certain issues that affect the kidney can cause a lower back pain. So if you have, say, a urinary tract infection or a kidney infection, or maybe sometimes even a kidney stone, the pain can tend to radiate down from the back. It can feel like the pain is affecting your lower back. It can move to your abdomen. Very characteristically, the pain tends to radiate down, say, your inner thigh towards your genitals, and it's especially associated sometimes either with a burning sensation when you're passing urine, or a change in color in your urine, or kind of very frothy urine. So some changes will be there in your urine or your urine output. If you experience this type of pain, and especially if you feel the pain is associated with the pain I've described, and you have fever and all the other symptoms related to urine, you should consult a urologist who can help diagnose this condition for you. Now, another cause for lower back ache could be period-related pain. I'm sure most women have experienced this. So what you feel is usually just near to the date when your menstrual cycle is about to start, you might feel a lot of pain or stiffness or even discomfort in your lower back. And then you might feel that there's also pain in your lower abdomen. It could be radiating pain. And then during your menstrual cycle itself also you can experience lower back pain. Of course, if you experience this, it's best to take rest and let the pain subside. You can apply a hot pad, to bring down the pain sensation in that area. And obviously once the cycle is done, your pain should subside. If your pain is not subsiding and it is continuing beyond your cycle, then maybe it's not a period-related pain. It might be some other pain. To diagnose this, you can talk to a general physician or a gynecologist who can help determine if your lower back pain is because of a period-related or a menstrual cycle-related issue. Now, another cause of lower backache could also be digestion related issues. Now, of course, when I'm saying digestion, you're thinking, okay, so the stomach is right here, upper part of your abdomen. How can I experience lower back pain? Now, see, when I say digestion related issues, there are a lot of organs in your abdomen. You might have a stomach here, then you have the liver here on the side, then the whole abdomen is covered by intestines. So, say if you have a stomach related infection or an intestine related infection, something like food poisoning, so you'll feel the discomfort in your stomach, which is more centrally located, but it can also feel like your pain is radiating to the back, or your back pain is radiating from your lower back to the front of your abdomen. So the whole area might feel really painful, bloated. You might also have some nausea, vomiting, or loose motions, abdominal cramps. Or sometimes what you could also have is, if you have like extreme levels of acidity, those kind of issues, very rarely you can feel sometimes that the pain is moving to your back or moving to the lower part of your spine. Everything seems to be hurting. That could be another reason for digestion related issues, lower back pain. But more commonly it would be concentrated around issues of your intestine, which could feel like it's moving to your back. How do you diagnose it? Well, obviously you can talk to a general physician or a medical gastroenterologist who can help diagnose this condition for you. Thank you.
Don't forget to like and share this video. For more such videos, do subscribe to the MFine channel and hit the bell icon to never miss any update.